We are not surprised by the rise of cases in hospital. We're not expecting those to be as high as they were 2 months ago, and we're following the situation very carefully.
Quebec Public Health now recommending a 4th dose of the COVID vaccine for the most vulnerable and saying the mask mandate won't be lifted sooner than April 15th as planned, with that still to be reviewed as the date gets closer. Dr. Luc Boileau saying Quebec is seeing a rise in cases of the more transmissible BA2 variant, which is making up at 50% of all cases in the province, but he stops short of calling it a 6th wave.
It's difficult for us to say if we're in a 6th wave right now. It's mostly after a few days or couple of weeks that we could say that, oh, okay, it was a wave. Now we're only observing some new cases that are going up, but not necessarily for a period of 2-3 weeks.
The green light given for 4th shots, those 80 plus, the immunocompromised, like people undergoing cancer treatments, can register with Clic Santé as of Tuesday, and they will start the vaccine campaign in CHSLDs and RPAs on that day as well. That it's not only about containing possible outbreaks, but mental health as well for seniors.
Isolation for elderly people does have impact as well. So we are recommending this second booster shot as a way to prevent cases and complications, but also outbreaks for these people.
Projections published Wednesday by the Institut National d'Excellence en Santé et en Services Sociaux suggests an upward trend in the number of new hospitalizations, as well as the number of regular beds occupied by COVID patients in the next 2 weeks, but ICU numbers to remain relatively stable. Dr. Boileau says they don't believe hospitalizations will rise as quickly as they did during Omicron, and that they don't regret the recent lifting of health measures, that they factored the new variant into their plans.
We were confident that with those measures that were now out of the scope, that they would have an impact on the contacts, and most probably an increase of contagiosity and cases.
When you look at Europe, cases don't necessarily transpose in hospitalization, but hospitals have been following this very closely, as well as the ministry, just to be sure they are prepared to take care of these patients.
The 3rd dose of vaccine is important to reduce the transmission. So the mask is not the only measure, but the 3rd dose of vaccine is also very efficacious to reduce the transmission.
In Montreal, Alyssia Rubertucci, City News.